Have you ever wondered why one person in their 80s can still enjoy morning walks, visit friends, travel, and stay active, while someone several years younger suddenly begins struggling with everyday tasks? Serious health problems do not always arrive with dramatic warning signs. Sometimes the first change is small. You feel more tired than usual. You become a little less steady when you stand up. A cut takes longer to heal. Your clothes begin fitting differently even though you have not changed your diet. You notice that simple activities leave you more breathless than before. And because each change seems minor on its own, it is easy to say, "I'm just getting older." But aging does not mean every new symptom should automatically be accepted as normal. Your body changes as you age, and some changes are expected. But a symptom that is new, persistent, getting worse, or interfering with daily life deserves attention. Today, we are going through 7 health changes adults over 70 should not simply brush aside. And pay close attention to number 7, because it may not look like a physical health warning at all. Many people separate it from the rest of their health, when in reality it can be an important clue that something has changed. None of these signs automatically means you have a serious disease. Many have simple explanations. The goal is not to frighten you or diagnose you through a video. The goal is to help you notice changes early enough to have the right conversation with your healthcare professional. The first sign is unexplained fatigue that does not improve the way you would expect. Everyone feels tired sometimes. A poor night of sleep, a stressful week, physical activity, travel, or even boredom can leave you feeling drained. That is different from noticing that your normal level of energy has clearly changed. Maybe you used to walk to the mailbox without thinking about it, but now you return feeling exhausted. Maybe preparing breakfast suddenly feels like a bigger task than it used to. Maybe you sleep through the night and still wake up feeling as though you have barely rested, or perhaps you have slowly stopped doing things you enjoy, not because you lost interest in them, but because you simply do not have the energy. Pilesard fatigue can have many possible causes. Medication effects, poor sleep, anemia, infection, thyroid problems, heart or lung conditions, nutritional problems, depression, and other health issues can all affect energy. The important thing is the change from your own normal. You do not need to compare yourself with another 75-year-old or 80-year-old. Compare yourself with yourself. Think about what you could comfortably do 6 months ago or a year ago. Has that changed noticeably? If it has, keep track of it for a few days. Write down when the fatigue appears, how you slept, what you were doing when it started, and whether anything makes it better or worse. That small record may give your doctor far more useful information than simply saying, "I feel tired." And if fatigue is sudden, severe, or comes with symptoms such as chest discomfort, fainting, severe breathlessness, or another alarming change, do not wait for a routine appointment. The second sign can show up in something you do every day without thinking about it. Walking, have your steps become shorter? Do you shuffle your feet more than you used to? Do you automatically reach for furniture when moving around the room? Are you hesitating before stepping off a curb? Do you feel less confident on stairs? Or have you started avoiding places because you are afraid you might lose your balance? Changes in walking and balance matter because many different parts of your body have to work together to keep you steady. Your muscles, joints, vision, feet, inner ear, nervous system, brain, blood pressure, and even some medications can affect the way you walk. Sometimes the explanation is straightforward. Perhaps a new medicine is making you dizzy. Maybe weakness developed after a period of inactivity. Perhaps your eyesight has changed. Maybe your shoes are no longer giving you enough support. But balance problems should not simply be hidden by quietly changing your routine. There is an easy trap people fall into. First, they start using the railing. Then they stop taking the stairs. Then they stop walking outside alone. Eventually, they become less active. Their legs become weaker, and their confidence falls even further. Instead, mention the change early. You can even ask someone you trust to watch you walk naturally across a room. Are your steps even? Do you lean to one side? Are you lifting both feet properly? Do you need your arms to push yourself out of a chair when you did not before? Do not turn this into a home diagnosis. Just notice what has changed. Falls are something you have to accept simply because you are older. Many fall risks can be identified and reduced. The third sign is visible on the surface of your body. Your skin, older skin, naturally becomes thinner and more fragile, so some bruising and slower healing can happen with age. But there is still a difference between a small change and a wound that seems to stop healing. Pay attention to cuts, sores, blisters, especially on the feet, or areas of skin that remain irritated longer than expected. Notice bruises that appear repeatedly without an obvious reason. Look for a spot that changes in size, shape, color, or appearance. And if you have diabetes or problems with circulation, paying attention to the feet becomes particularly important. Imagine noticing a tiny blister on your foot. It barely hurts, so you ignore it. Days pass, then another week, the area is still open. Perhaps you cannot feel it very well, so it does not seem urgent. That is exactly why looking at your skin can be valuable. Pain is not always a perfect warning system. Once or twice a week, take a moment to look at areas you may normally ignore, including your feet. If you have difficulty seeing the bottom of them, use a mirror or ask someone you trust to help. If a wound is getting worse, showing signs of infection, or simply refusing to heal, have it examined rather than continuing to wait. Your skin can sometimes show you a problem before you feel one. The fourth sign involves appetite and weight. It is common for taste, smell, appetite, and eating habits to change somewhat with age. Medications can change the way food tastes. Dental problems can make chewing uncomfortable. Living alone can make meals less enjoyable. Illness can reduce appetite. So can depression. But what deserves attention is a meaningful change that you did not intend. Perhaps your trousers are suddenly loose around your waist. Maybe friends comment that you look thinner. You step on the scale and discover that your weight has been moving down even though you never tried to lose it. Or perhaps food that once appealed to you suddenly feels uninteresting. A few pounds moving up or down once does not tell you much. A pattern tells you more. Try weighing yourself under similar conditions once a week and simply write down the number. Do not become obsessed with daily fluctuations. Look for a trend. Also pay attention to why you are eating less. Is chewing painful? Do you feel full very quickly? Does food taste different? Are you having trouble swallowing? Do you feel nauseated? Did the change begin after starting a new medicine? Or has your interest in food fallen along with your interest in other activities? Those details can help a healthcare professional understand what may be happening. And the opposite matters too. A sudden, unexplained increase in weight, especially if it happens along with swelling or increasing breathlessness, also deserves a conversation with your healthcare provider. If you have made it this far, think for a moment about these first 4 signs: fatigue, changes in walking or balance, skin that is not healing normally, unexpected changes in appetite or weight. Which of these do people around you dismiss most often as just old age? Tell me in the comments. Your answer may help another person realize that they are not the only one who noticed the same change. Now let us move to the 5th sign, and this is the one that often causes the most worry. Almost everyone forgets things from time to time. You walk into a room and forget why you went there. You struggle for a moment to remember someone's name. You put your glasses somewhere and later cannot remember where. Those moments alone do not automatically mean dementia. The changes that deserve more attention are the ones that begin interfering with everyday life or are clearly different from your usual behavior. Maybe you have made the same familiar recipe for decades and suddenly cannot follow the steps. Perhaps you get confused on a route you know extremely well. You ask the same question several times within a short period without remembering the earlier answer. Managing bills or medications becomes much more difficult than it used to be. You begin losing track of dates, appointments, or familiar routines, or family members notice changes that you have not noticed yourself. One of the worst things you can do is hide these changes because you are frightened of what they might mean. Mirror problems do not have only one cause: sleep problems, medication effects, depression, nutritional deficiencies, hearing or vision problems, infections, and other medical conditions can affect thinking and memory. And if a cognitive disorder is developing, discussing changes earlier gives you and your family more time to understand what is happening and plan appropriately. You do not need to test yourself every hour. Instead, notice patterns. If something unusual happens, write down what happened and when. If someone close to you says, "You've asked me that several times today," try not to become defensive. Treat it as information. The goal is not to prove that something is wrong. The goal is to notice when something is different. The 6th sign is a change in your breathing. Suppose you have always climbed the same flight of stairs. You reach the top and breathe a little harder. That may be completely expected. But what if an activity that used to feel easy suddenly leaves you noticeably short of breath? You make the bed and have to stop. You walk from one room to another and need time to recover. You find yourself pausing halfway through a normal conversation because you need to catch your breath. Or you notice that the problem has gradually become worse over several weeks or months. New or worsening shortness of breath deserves attention because breathing can be affected by many things, including heart conditions, lung problems, anemia, infection, medication effects, reduced physical conditioning, and other causes. Again, what matters is change. Do not compare your breathing with someone else's. Ask yourself whether your own ability has noticeably declined. Also pay attention to what happens with the breathlessness. Does it come with swelling around your ankles or legs? Does it happen when you lie flat? Are you coughing more? Do you feel dizzy? Does your heart feel as though it is racing or beating irregularly? Is there chest pressure or discomfort? Those details matter. And there is an important difference between a gradual change that deserves a medical appointment and a sudden emergency. If you develop severe or sudden difficulty breathing, especially with chest pain or pressure, fainting, sudden confusion, blue or gray lips, or other severe symptoms, seek emergency medical care immediately. Do not simply assume that breathlessness is the price of getting older. Aging can change endurance, but a meaningful change in your normal breathing deserves an explanation. And now we come to number 7. This one is easy to separate from physical health because you cannot see it on an X-ray or bandage it like a cut. It is a persistent change in sleep or mood. Perhaps you used to sleep reasonably well, but now you wake at 3 in the morning night after night and cannot return to sleep. Maybe you have become unusually restless. Perhaps you sleep much more than before. Activities you once looked forward to no longer interest you. You stop calling friends. You stop tending the garden. You no longer feel excited when family visits. You may not even feel deeply sad. Sometimes you simply feel flat, detached, irritated, anxious, or unlike yourself. That matters. Changes in sleep and mood can happen for many reasons. Grief can affect them. Pain can affect them. Medications can affect them. Depression and anxiety can affect them. So can some physical illnesses and changes in overall health. This is one reason emotional health should not be treated as something completely separate from the body. Imagine a 79-year-old man whose wife has recently passed away. For a while, everyone expects him to withdraw. Grief is natural, but months later, he is barely sleeping, rarely eating, no longer speaking with friends, and has stopped doing everything that once gave structure to his day. It would be easy for everyone around him to say, "Of course he feels this way. He is older, and he lost his wife." But grief and depression are not the same thing. And struggling emotionally does not become less important because someone is older. A conversation with a doctor may uncover depression, medication issues, sleep problems, nutritional concerns, or another factor that can be addressed. So take emotional changes seriously. If you have not felt like yourself for weeks, say it out loud. Tell someone, tell your doctor, tell a family member. And if you notice this change in someone you love, do not immediately lecture them about being more positive. Ask them how they are actually doing. Listen to the answer. There is one idea I want you to remember from this entire video. Do not panic over every ache, bruise, forgotten word, or tired afternoon. The human body changes from day to day, but do not automatically explain away every new problem with the words, "I'm getting old." Either look for change, look for persistence, look for symptoms that are getting worse, and look for things that are beginning to interfere with the life you normally live. Unexplained fatigue, changes in balance or walking. Cuts or sores that are not healing normally, unexpected changes in appetite or weight, memory problems that begin affecting familiar daily activities, new or worsening shortness of breath, and persistent changes in sleep, interest, or mood. None of these signs gives you a diagnosis. They give you a reason to pay attention. Sometimes the answer will be simple. A medication may need to be adjusted. Your eyesight may need to be checked. You may need better footwear, improved nutrition, treatment for anemia, help with sleep, physical therapy, or another relatively straightforward change. Sometimes further investigation may be needed. Either way, knowing is usually more useful than guessing. Your goal is not to spend your later years worrying about your health every morning. It is the opposite. Paying attention to important changes can help you make informed decisions, ask better questions, and protect the independence that matters so much. So after this video, do one simple thing. Think about your own normal. How is your energy? How steady do you feel when you walk? Is your weight stable? Are wounds healing? Has your memory noticeably changed? Has your breathing changed? Are you sleeping normally? Do you still feel interested in the people and activities that matter to you? If something clearly stands out, write it down. And if it has persisted, worsened, or concerns you, bring it to a qualified healthcare professional rather than dismissing it. Growing older does not require you to become suspicious of your body, but it does make knowing your own body more valuable. You have spent decades learning how you normally feel. That experience matters. When something changes, you are allowed to ask why. Before you leave, tell me which of these 7 signs surprised you the most. And if this video helped you think differently about healthy aging, share it with someone you care about who may need the same reminder. Stuesber, if you want more practical conversations about staying healthier, stronger, and more independent as you age, take care of yourself. Pay attention to meaningful changes, and never be embarrassed to ask for help when something does not feel right.